Good afternoon, everyone. I'd like to welcome you to Facebook Live. I'm Johanna Beliveau, President and CEO with Visiting Nurse and Hospice for Vermont and New Hampshire. And I'm very happy to introduce you to my colleagues, Patty Rooney, Director of Human Resources, and Amanda Fay, Manager of Clinical Education and Evidence-Based Practice, who are joining me today. Today, we'll be talking to you about how VNH supports staff who provide care in people's homes. Given there is not much exposure to home-based care in our educational programs, there is a hesitancy about working in this environment, and potential applicants have many questions. Caring for people in their home is a very rewarding experience, but also quite different from working in a clinic or a hospital setting, which is why we're here today, to answer a few of the questions that we routinely hear. So we recognize there are a lot of unknowns in home-based care, and we support staff in many unique ways. And Amanda and Patty will share with us today what our orientation and ongoing supports look like here at VNH. We're also very happy to answer your questions in real time, so I encourage you to put questions into the chat box, and we'll make sure to spend a few minutes on that before we end our time together today. So with that, I'd like to get right into it, our conversation, and I'm going to turn to Amanda to start with you. So Amanda, you've had many experiences in a variety of settings. Talk to me about what you've learned since joining VNH about home-based care, and how have you changed your approach to education and clinical support, given what you now know about working here at VNH?
Absolutely. Well, the first thing I learned about home care is the level of autonomy that our clinicians have, and creativity, because each environment that they go into is unique to that family and to that situation. Now, what I found is home care allows the clinician to function to the fullest extent of their licensure. And that's really exciting for me, because I mean, then, the person can grow and develop right where they are and in the role that they're in. Now, that being said, we do, right, they get to function to the fullest, but they also function with evidence-based practice. That is a particular passion of mine. Now, coming from the different types of environments, like I've taught in baccalaureate nursing, I've taught in, the clinical environment, I've brought with me some teaching strategies to home care. Now I have had to, because home care is different, which is great. And I've changed it just a little bit. So we've really developed and explored clinical reasoning. We've started to develop education on the go, right? Because our clinicians are on the road. How can we reach them where they're at? So we're exploring some podcasts and we do skill days. So that's the education on the go. So we go to the drop sites, each drop site every month. And we have a thing called text an educator. If the clinicians have a question, we're there to support them. So they can just text us, or we give them the information in real time and help them troubleshoot while they're in that patient's home. Now, with that continuing professional development, it's really picking the brains of our clinicians. What do they need? What do they want? And so how can we give that to them as they go and care for our community? One of the things that I'm really excited about is our onboarding. We've taken a lot of time and thoughtfulness in developing this new onboarding program, and it's individualized. Each one of the people who come to us and join our team, they're unique. They come with a different, life experience, different, educational experience. And so we make sure that we create that onboarding plan for them that reflects that. And what I really love about this is it's a slow progression. So the person gets to develop, gets to grow in their role, and it's not that, they don't get scared. So we get to follow them along on their journey as they transition into our teams. And that's one of the pieces that I'm just sorry, I just get so excited about that
No,
onboarding
it's
plan.
great. You raised some really great points, Amanda, and I think some key takeaways for anyone who might be considering a transition into a home-based care setting is, and particularly here at VNH, recognizing that we value experiences from different places. They certainly contribute to and allow people to take those skills, their knowledge and skills, and bring them into home-based care. Yet at the same time, we recognize that this is a different place. It's a different way of working, and we need to build on the knowledge and skills that they have. And create sort of that whole approach to how do you do this care in the home setting. So I think that is really useful for our colleagues and listeners out there today who might be thinking about home-based care. The other piece I would just actually call a little attention to is, and what I know and I've seen you really bring into the education program since you've been with us, is understanding the complexity of home care. So if you could actually just spend a minute talking about, people think that home health, hospice, community-based care is somehow less complicated, less acute. They're going to lose their skills by coming into a home-based care environment. Could you speak just a little bit about the acuity of our patients and how you're training to that?
Oh yeah, absolutely. We do a whole series on disease management and how do we manage that disease process with the patient in their home. Now, when we do get it's not just about disease management and teaching. A lot of our patients are discharged. We have many patients who are discharged with drains, pleural drains, chest tubes. We have nephrostomies. We have C collars. We have, so if you think that, so if someone who's considering home care, if they think that that skill piece is going to be lost, it's not. It's actually, I had someone tell me the other day that they see more lines, drains, and airways than they have in their med-surg clinical. So it's really an exciting time to be part of home care.
Yeah. Thank you. Yeah, I do hear that question a bit, so I appreciate you taking a minute to talk about that with us. Now, actually, I'd like to shift gears a little bit and ask Patty, who leads our HR team, to talk a little bit about the benefits of working at VNH. What are some of the reasons someone should consider a career here with us?
Well, Johanna, I think about what drew me to VNH, having had no experience in healthcare and human resources or otherwise. And during that process of interviewing and interacting with the team here, I felt this sense of passion and energy that I didn't expect. There was a deep connection, a deep personal connection with the work, and some understanding of how people were bringing their skills and experience to patients and families and communities to really make a difference in people's lives. And I was really struck by that and very interested in how could we sustain that? Like, how does an organization sustain that passion and that energy? And then I came here and then I understood. And the VNH culture is really about, and some of the things that Amanda just talked about is, the collaboration and the teamwork, that's celebrated. There's an expectation that we work together and that there's no problem we can't solve together. Yet, people are giving an opportunity to do a lot of independent thinking. They have autonomy. I think you just talked about it, Amanda. If somebody's in the field, they have the latitude to make some real-time decisions, knowing that if they get stuck, that there's a resource, a phone call, a text message away. And that is huge, particularly as, people are going into homes and need to feel comfortable and confident in their skills. And we did hear today, during one of our open forums, that the orientation program, the onboarding that Amanda and her team has put together is really having a positive impact. People feel it's the best program they've gone through. And that's really important, as you said before, coming into home health maybe from a different, setting and coming here and doing that. The other thing I think is really important is we very much celebrate continuous learning, professional growth. We give people the opportunities to stretch themselves. And I've gotten that feedback a lot from current employees and about how they feel like they've learned so much more in the past year than perhaps they did in the past 5 or 10. So that's really exciting. And thank you, Amanda, and your team. And then one other thing that also strikes me and why I think people would appreciate an opportunity to work here is that the team really lives our guiding values of teamwork, respect, innovation, integrity, accountability. And I think all of that's reflected. We just had an employee engagement survey, and in our results, I think you could really see that commitment and that pride in working for this agency. So when I think about coming to VNH, I came from higher ed. This was totally new for me, and it's been the most wonderful experience. And we hear that a lot among the teams, that they really appreciate the support, the energy, everything about this organization.
Thank you, Patty. I really appreciate all of those elements that you just described in terms of who we are as VNH. And, that's really important, I think, for our audience today to hear and understand, because everyone has many opportunities to consider, right? There are clinical positions, direct care staff positions, administrative positions in every setting, sort of in every location that people might want to work. And so why come to VNH? And I think you just described that very well in terms of what does it feel like to work here, in addition to the supports that Amanda described. So, we are also in the midst of some significant shortages in some of our roles, and nursing specifically. And we know that the nursing shortage is being felt in various parts of the country. We also know that rural communities are being particularly hard hit, more so than our urban counterparts. So I know we have a lot going on in terms of recruitment and workforce development, and I would really appreciate both of your thoughts on what VNH is doing to address that shortage. And so maybe I'll start with Amanda, and you can talk a little bit about our programs, with students and oncoming staff and other things that you're working towards.
We're currently collaborating with our partnering schools to expose them more to what home care is, because often it's one of those hidden specialties. So we're looking to get into their curriculum and really, help the students understand that this is an option, and you can actually use your sleuthing skills, which we all develop in nursing school, to their highest extent. We're looking to develop clinical opportunities for students. So not only expose them to home care in a lecture kind of format or activity, but also in the field with one of our clinicians. We're really just kind of looking to put the word out, let them know that home care is an option. It's a great specialty to be able to take time and think through, and to develop those clinical reasoning and those skills that you really want to hone in on as a practicing nurse.
Yeah, that's excellent. And actually, I see a question from an audience member, so I'll actually pose that to you now because it relates directly to what you're describing. So those of us who have nursing backgrounds, we do understand that our undergraduate programs have very limited exposure typically to home-based care environments. But we do have a residency program. So like many of our hospital partners who have had residency programs for some time, the home health residency is somewhat unique and different than some other agencies in our region or even across the country. So could you talk a little bit? The question here is, how does the nurse residency at VNH differ from hospital-based residencies and those that they're familiar with at Dartmouth-Hitchcock, as an example?
Absolutely. So very excited about our nurse residency program. Now we are collaborating with other home health agencies in the state of New Hampshire. And so all of the nurse residents get together monthly. Actually, when they first start, it's really every Wednesday to begin that social and psychological support. Because when you transition to practice, you need those roots to ground you. Now, they go through classes, but when they come back to us, what we do is we do the really slow development. They have 3 patients up to month 4 and 4 or 5, and then we work them up. We work up their patient load. And that differs from a lot of nurse residencies where the patient load is up to the max at the end of their 3 months. So we work on a 12-month residency program and slowly increase their load to be able to ensure that they're developing the way they should. Their clinical reasoning is going along with their progression. And before they even go into the nurse residency, we give them a really comprehensive onboarding and have them work with their preceptors. So it's I haven't encountered a nurse residency like this. Very excited about the support, and I actually, if I were to go back in time, I wish I could have a nurse residency like this.
Yeah, thank you. I know residencies didn't exist when I transitioned from undergraduate to practice, and so I agree. A nurse residency program would have been enormously helpful. And I appreciate what you're highlighting here in terms of the slow ramp up to home health or hospice care, recognizing that, again, once these clinicians are sort of launched into their role, they are independent in the field. And so we have to be, and they have to be, fully confident in their skills and what they're going to face as they walk into that next home. That they have the tools, knowledge, resources to make the best decision and taking care of that patient. So recognizing that for someone who's just transitioning into practice in our environment, that really does take a full year to accomplish that goal. So thank you for that. All right, so Patty, I'm going to come back to you, and we're shifting back to the conversation around nursing shortage and what VNH is doing about that. So can you talk a little bit more from the HR and recruitment side of things? What is VNH doing to address that current shortage?
So we recognize that in this region, it's a highly competitive market for nursing. So whether that's an LNA, an LPN, or an RN, it's a competitive market. Some of the things that we've tried to do that a little less traditional for our particular organization have been looking at creating scheduling options for people so that people don't have to come to the organization looking for a full-time role, that we are able to be flexible and create some part-time options for people. So that's opened up the door, not only for people who may have other obligations, family obligations, and they just want to work a couple of days a week, but also for people who are working somewhere else and are looking to pick up some time. So we're investigating those types of options. I think for an extrovert like me, the pandemic has been really difficult on the recruiting side because I like to meet people in person and have those types of interactions. So we've really had to think about how do we meet people where they're at. So we're doing a lot more in terms of virtual job fairs, career fairs. We're really using social media platforms like Facebook and Spotify. So we're trying to think out of the box a little bit more because it's been tough. I mean, not only is there a shortage, but we're in the middle of a pandemic, which, you know, limits our ability to see people in person. So that's been hard. One thing, or actually two things, you know, the health system, as Amanda was talking before, I mean, the health system has been collaborating with us on a few different initiatives, including helping us on the recruiting side and the marketing side to get the word out about home health. We're part of that continuum of patient care, and we're a critical piece of that. And I think as a system, we recognize that. One thing that I did hear today that made me feel good coming from a staff member was that they were appreciative of the efforts and the responsiveness of leadership regarding trying to handle this nursing shortage. So that felt good, that people are understanding that we are putting our best steps forward and trying to, you know, deal with the staffing issue.
Yeah, thank you. And it's right, it's not easy. And again, all of us in healthcare recognize the number of challenges that we face right now. And I want to pull on a comment that you made around the use of social media and how we're working to get the word out. So if I were considering coming to work at VNH, what are the best resources? Where should I go to understand what's available, what the jobs are, and what's happening here at VNH?
Sure. Well, you can go in a lot of places right now because we are really trying to flood the market with VNH information. So we're on, you know, we have information on the local channels like Facebook channels. That doesn't, you know what I mean? Like the Spotify, Facebook, etc. But we're also targeting like nursing, like industry face boards and job boards is what I'm trying to say. I'm getting caught up in the social media piece, the Facebook part. But you can find us on Facebook. We do have a Facebook page. Is that what you were asking? We have a Facebook page. We also are on Spotify. We're in many different venues. You can also actually go to our career page at vnhcare.org. So that would be, to me, the first place to start.
Great, thank you. You also mentioned COVID-19. So we actually haven't focused on that in this conversation, but it has been the focus of many, many conversations, of course, here, and I'm sure across healthcare organizations around the world, really. But you know, much has changed in the last 9 months since the pandemic has arrived in our region. And it's changed the way we do our work here. Actually, Amanda, I'm going to shift this one back to you in terms of, you know, if I'm a new team member coming into VNH in the context of COVID-19, what can I expect? What does my day look like? How am I protected? How am I protecting my patients?
So in terms of, so I'll speak about onboarding and on. So what we try to do is we try to have as much as we can remotely. So we do a lot of teaching remotely. Our skills are in person, but in person, we're wearing masks, we're socially distancing, we're washing our hands every time we think of chocolate. Well, actually, we wash it twice every time we think of chocolate. That's just sorry, that was an inside joke in onboarding. So we do a lot of self-protection, but we also protect each other. We remind each other we're a little too close. Let's keep our distance. Now, when they transition to the field, we do give them our infection prevention teaching. We go by all the CDC guidelines, and all of our clinicians get a face shield. They get masks. And the appropriate, gowns, gloves for whatever further precautions. Because we're really thinking about standard precautions are really now our masks and our shields. Whereas before, standard precautions really constituted, something a little less, but that's part of our everyday work now. Right. So that's it regarding.
That's a great overview. I think, one of the things too that I appreciate, and even when I have an opportunity to go out into the field and do a visit with a direct care team member, that, again, different from some of our counterparts in other settings, right? The hospital and the clinic is, everyone right now has to wear our masks and our shields to be safe and to keep our patients safe. But we get to take them off, right? So we come out of the home and we get in our car and we can take those things off and get some fresh air and sort of decompress a little bit from that visit. And then you do take the appropriate steps in terms of hand hygiene and cleaning and things of that nature. And then you get ready to go into that next visit. So in this COVID-19 environment, what I understand and what I see when I'm in the field is that you've taught our clinicians very well how to do that, how to keep themselves safe. And I know that they're appreciative, and they talk about being appreciative of being able to take it off. Because and right now it's cooler weather, but they get warm, they get foggy. There's all these challenges that team members, again, across the region are faced with in terms of this new way of working, which is now fairly standard precautions, right? Standard precautions for the way that we work. So again, I think something else for folks to understand and consider about working here at VNH is that while we are as diligent as all of our other care settings, that we do have opportunity to work a little bit differently in those in-between moments from when we're in the patient's home. Yeah. So I really appreciate this time with you today and hearing about all the things that are happening at VNH in regards to our supports for clinical education and the recruitment and onboarding of new staff. We've covered a lot of territory. I'm trying to think if there's anything else that we want to make sure our audience hears from us today before we end our time together. So we've talked about, from the student experience coming into home health and hospice and having that exposure. We've talked about nurse residency. We've talked about onboarding and clinical education. We've talked about professional development. So really the full spectrum of what a clinician would want to hear and want to feel and experience in transitioning into our environment. So I actually think we've covered it pretty well, but I'll ask if there's anything else on your minds that you would want to make sure our audience hears from us today.
I'd like to say, if as a nurse, if I had known of the opportunity in home health, I would have come here sooner. Because you get to be that critical thinker. You get to think outside the box. You get to interact with a patient one-on-one and with their family, making a difference, not only in their lives, but in the whole community. So I just want to say thank you for, home care is really a pretty awesome specialty.
It is an awesome specialty, and not many people really know that. So I appreciate you bringing that forward. And we're going to keep having these conversations and keep spreading the word. So again, thank you to our audience today for taking a few minutes to be with us and to ask your questions. And VNH is here for you, happy to talk with you about opportunities in our future. So again, thank you very much, and I hope everyone has a good rest of the day, and stay tuned for future Facebook Live events to learn more about VNH. Take care.
Thank you.